Today, I'm going to talk about the cost effectiveness of the integrated medicine. So, the first point I would say about reducing the financial burden of the chronic diseases, which is the long term and big financial burden on healthcare systems across the globe. Chronic diseases account for nearly 80% of the healthcare costs in the developed countries and are primary driver of the sustainable health expenditure or unsustainable health expenditure. These conditions such as diabetes, heart disease, depression, and osteoarthritis typically require long-term medication, specialist follow-ups, diagnostics, and hospitalizations. Integrated medicine offer cost-effective solution by addressing not just the symptoms but the root cause of the chronic illness through multimodal interventions that empathize and emphasize lifestyle, diet, stress regulation, and preventive care. By combining the pharmacological precision of the modern medicine with the non-invasive, low-cost complementary and alternative medicine therapies such as yoga, acupuncture, and nutritional medicine, healthcare systems can reduce reliance on the expensive intervention. In 2022, Rand Corporation analysis concluded that integrated care pathways led to 20 to 30% reduction in the total per capita healthcare expenditure among high-risk chronic disease patients. This underscores the potential of the integrative models to not only improve the healthcare outcomes but also relieve the economic burden on the healthcare systems. The second point I would like to emphasize is lower pharmacological and pharmaceutical costs and better adverse event management. Pharmaceutical expenditures make up a significant share of the total healthcare costs, especially in the aging population with multiple comorbidities. The problem is compounded by the drug-related hospital admissions, estimated to account for 5 to 8% of all hospitalizations in the UK, costing NHS over 466 million pounds annually. Integrated medicine can reduce these costs substantially by lowering the doses, frequency, and even necessity for certain drugs through adjunctive use of complementary and alternative medicine. For instance, in NHS integrated back pain programs where patients received yoga and acupuncture alongside physiotherapy medication, and the overall need for medication was dropped by 35%, leading to substantial cost savings and fewer drug-related complications. Likewise, herbal supplements such as boswellia and turmeric used under supervision have been shown to offer compatible pain relief in addition to non-steroidal anti-inflammatory medicines and significantly reduce the side effects of particularly the gastrointestinal side effects of the non-steroidal anti-inflammatory effects. We know that Boswellia serrata has 5-lipoxygenase inhibition properties, and turmeric has properties to inhibit the nuclear factor kappa beta, which is an anti-inflammatory pathway activator. By preventing the downstream consequences of the over-medication, integrated medicine contributes to both direct and indirect healthcare cost reductions. The third point I would like to highlight is prevention-oriented approach, which yield long-term savings. One of the most powerful levers of the cost effectiveness in the integrated medicine is its focus on the prevention and early intervention. Complementary and alternative medicine disciplines are inherently preventive, emphasizing the constitutional balance. For example, Prakriti in Ayurveda, lifestyle optimization and season routine, mind-body coherence, etc. And all of these, when integrated into the modern primary care systems, these approaches help to detect the risks earlier and promote healthier behaviors. For example, US Ornish program for reversing the heart disease, which include yoga, plant-based diet, stress management, and social support, along with conventional care, demonstrated a 50% reduction in angina episodes and significantly decreased the hospital readmissions within 1 year, translating to almost $30,000 savings per patient annually. Similarly, Tai Chi programs in fall prevention among elderly population have reduced hip fractures and associated care costs by up to 43%. These outcomes validate the economic logic of upstream investment in preventive integrative therapies to reduce the downstream costs. The fourth point is cost utility and economic evaluation studies which support the integration. A growing body of cost effectiveness and cost utility analysis reinforces the economic value of the integrative models. A systematic review by Herman et al. In PMG Open evaluated 67 complementary and alternative medicine-based interventions and found that 61% were cost-effective and 18% were cost-saving, particularly in the chronic pain, cardiovascular disease, and anxiety. In Germany, where homeopathy and naturopathy are reimbursed under statutory insurance, integrative care led to 10 to 20% reduction in per capita spending on the outpatient visits and drug prescriptions for the chronic conditions. In UK, the social return on investment for social prescribing models that include complement and alternative medicine components such as mindfulness, Tai Chi, and guided imaginary is estimated to be 2.3 to 3.5 pound saving per £1 invested. And this is due to reduced GP visits and improved well-being. These findings provide robust economic justification for policymakers to incorporate complementary and alternative medicine services into the national health system as part of integrative care strategy. The other point I would like to mention is scalability and sustainability of the healthcare systems worldwide. A global health system facing rising costs with aging population and resource constraint is a big challenge. The scalability of integrated medicine makes it an attractive solution for the long-term sustainability. Unlike high-tech biomedical interventions, most complementary and alternative medicine modalities require minimal infrastructure, are scalable via digital delivery, such as teleyoga, telemedicine, virtual acupuncture, consultation, acupressure, etc. And these all can be taught to the communities for self-care. Community-based Ayurvedic health camps in India, for instance, have demonstrated significant reduction in the disease incidence and costs within the minimal investment in certain areas. In the UK, pilot programs using voluntary and the volunteer delivered mindfulness and yoga sessions in deprived communities led to better management of depression and anxiety at less than half the cost of standard NHS interventions. Moreover, integrated care empowers patients to take responsibility for their health, reducing dependence on the expensive tertiary care and better patient satisfaction. Thus, integrated medicine not only offers immediate cost advantages, but also aligns with the global goals of universal health coverage, equitable access, and sustainable development in the healthcare. Thank you.